Think of the arteries that supply your heart like roads of the 401. Blood cells are cars carrying oxygen and nutrients to keep your heart pumping in order to supply blood for your entire body. But as we all know, when Canada's busiest highway comes to a screeching halt, no one is going anywhere. For drivers, their commute just takes longer. But unfortunately for the heart, it signals the onset of a heart attack. This is when red blood cells can't supply oxygen to the heart to keep it pumping. This happens because fatty cholesterol deposits, called plaques, build up on the walls of the arteries that supply the heart, which can restrict blood flow. Sometimes these plaques rupture, which can cause a blood clot, severely restricting blood flow or blocking it altogether.
If you glance at the car next to you on the 401, you'll witness emotional distress, frustration, and the occasional rage text playing out in real time. Similarly, your body sends you signs that your heart may be in danger. But there's something important to know. These symptoms can look different in men and women.
Symptoms that both men and women may experience: chest pain that feels like tightness, squeezing, or pressure. Pain that spreads through the arm, neck, jaw, nausea or vomiting, shortness of breath.
For women and older adults, they may not always have chest pain or pressure in the upper abdomen or upper back, fainting, indigestion, extreme fatigue and weakness.
Call 911 or emergency medical services, or have someone drive you to the nearest hospital. If your doctor has given you nitroglycerin, now is the time to use it. It can help relax and open those blood vessels, kind of like clearing a lane on a congested highway. As for aspirin, it can help prevent clots and reduce heart damage, but it may interact with other medications. Do not take aspirin unless your healthcare provider or emergency personnel tell you to do so.
Heart attacks are usually diagnosed in the emergency department, where the care team jumps into action. Common tests carried out may include electrocardiograms, blood tests, chest x-rays, echocardiogram, angiogram, CT scan. One or a combination of these tests can reveal the health of the heart, its arteries, and surrounding structures.
Urgent treatment requires restoring blood flow and oxygen to the heart and may include angioplasty and stenting, which open a blocked artery; coronary artery bypass grafting, where a healthy artery is taken to bypass the blocked area, creating a new path for blood flow. Think of this like building a detour around a closed highway exit.
Call 911 or emergency services before attempting to help. If they have lost consciousness, quickly check if they're breathing and if they have a pulse. No pulse. That's when you begin CPR. If you've never been trained in CPR, don't worry. Just do hands-only CPR. Attempt 100 to 120 chest compressions in a minute to help keep blood circulating throughout the body. That's compressing to the rhythm of Staying Alive, the song. If you're trained in CPR, ensure you perform 2 rescue breaths after 30 chest compressions, still aiming for 100 to 120 compressions in a minute. Either way, you're keeping blood flowing until help arrives, and that's huge.
Though we can't always prevent traffic on the 401, there are ways to reduce your chances of a pileup on your heart's highway. Consider 30 minutes of daily moderate intensity exercise to keep your heart healthy. Eat a healthy diet by limiting consumption of trans and saturated fats. Keep your numbers in check. We're talking cholesterol, blood sugar, and blood pressure. And your doctor can run tests to see where you're at with all of these. If any of them are running high, no worries. They can prescribe medication to get things back on track, which seriously lowers your chances of having a heart attack. Quit smoking and limit alcohol intake. Find healthy ways to control stress, either through mindfulness or regular exercise.
Remember, knowing the signs of a heart attack and acting fast can save a life, even your own. At the hospital, doctors work quickly to restore blood flow through medications and procedures that can save the heart muscle and prevent future heart failure. But prevention is just as powerful. Taking care of your heart today protects you for tomorrow.